There's a very specific, uh, almost visceral feeling that I think pretty much everyone listening can identify with.
Hmm.
It's that moment you look at your calendar, you see a certain appointment coming up, maybe next Tuesday at 2, and your stomach just sort of
Hmm.
drops. You let out a sigh.
The universal sigh of, oh, not this again. We've all been there.
Exactly. I am, of course, talking about the dentist. For so many of us, a dental visit feels like a chore, at best.
An interruption.
It is an interruption, and at worst, it's something we actively dread.
Mhm.
It's noisy, it can be invasive, it's expensive, and there's always that little fear that they're going to find something wrong.
And judge you for it. It's a classic avoidance behavior. We tend to see the dentist as like a repair shop.
Right.
You only go when the engine's smoking, right? When you have a toothache. The logic is, if it's not broken, why go looking for trouble?
But that is the exact mindset we're going to challenge today.
Yeah.
We're doing a deep dive into a document that basically says we've got it all wrong. We're looking at the Comprehensive Guide to Preventive Dental Care at Brookside, from a practice called My Gentle Dentist. And their whole argument is that the dental chair isn't a repair shop. It's a critical maintenance system for your entire body.
It's a complete shift in perspective. And if you read this guide, you realize that what happens in that hour is it's really a sophisticated series of checks designed to keep your whole body running, not just your teeth.
Which is our mission for this deep dive. We're going to decode the 5-step routine checkup they lay out. We're going to figure out what is actually happening while we're staring at the ceiling.
Uh-huh. We'll unpack why preventive is the key word here. And we are going to scrutinize their claim that dentistry can actually be gentle. Because, let's be honest, gentle is not the first word that comes to mind when I see a dental drill.
That's a fair skepticism. It almost sounds like an oxymoron. But as the source details, the tech has really evolved to back that claim up.
Okay, we'll get to the gadgets. But first, let's just talk about the core philosophy. This document is covered in the phrase preventive care.
It says regular dental checkups and cleanings are essential. But then it goes deeper, saying the focus is to avoid cavities, gum disease, and other oral health issues.
Right, and think about it like this. Think about a car. You don't wait for the engine to explode on the highway before you get an oil change.
No.
You change the oil specifically to prevent the explosion. That's the whole thesis here. It's about shifting from reactive care, which is always painful and expensive, to proactive care.
And speaking of expensive, that's the first big why that jumped out at me. The guide lists a few benefits, but the one that hits my wallet is the financial part.
Oh, it's a huge motivator,
Yeah.
and they're very explicit about it. The source says preventive care saves money on costly treatments.
They actually list things like reducing the need for expensive procedures like root canals or extractions.
And that's just the economics of it. I mean, think about the cost difference. A routine cleaning is a known lower cost. A root canal, a
Yeah.
crown, an implant because you had to pull a tooth you ignored.
Yeah.
You're talking about an exponential jump in cost.
So a checkup is basically an insurance policy for my future bank account.
Precisely. By the time you actually feel pain, which is when most people finally call, the damage is usually deep. It's in the nerve, it's in the bone. And that's always going to be more expensive to fix.
Okay, so it saves money. I get that. But here's where the document gets, well, really heavy. And this is the part I think most of us, myself included, just completely overlook.
Mm-hmm.
We think of teeth as these, hard little things in our mouth, totally separate from the rest of us. But the source makes this direct, hard link between your mouth and your overall physical health.
And this is where the deep dive gets really fascinating. The medical community is focusing on this more and more, and this guide puts it right up front. It says clearly, poor oral hygiene is linked to heart disease, diabetes, and other health conditions.
Wow. I mean, that's a massive escalation. We went from avoiding a cavity to avoiding heart disease. That feels like a huge leap. How? How does that even work? How does a dirty tooth affect my heart?
Yeah. Well, it's the biology of the mouth. If you think of your mouth as a box that's separate from your body, you're missing the point. The mouth is the gateway. And it's highly vascular.
Meaning a lot of blood flow.
A ton of blood flow. So if you have gum disease, which is just infection and inflammation, that barrier starts to break down.
Okay.
And the bacteria from your mouth can get into your bloodstream. Once it's in the blood, it can go anywhere. So this guide is basically saying when you're in that chair, you're not just protecting your smile, you're managing a bacterial load that can directly affect your heart.
So skipping a cleaning isn't just risking a toothache. It's a gamble with your systemic health.
That's the implication. And it ties right into their point about early detection. They say they can identify problems before they worsen.
Right.
If you can catch gum disease early when it's just gingivitis, it's completely reversible. You just clean it up. If you wait until it affects the bone, that's a whole different story.
Okay, the stakes are officially set. Money, pain, and protecting my heart. So let's get into the mechanics. The source breaks the appointment down into this 5-step routine checkup.
Let's deconstruct it.
Yeah, because I think most of us just open wide and wait for it to be over.
We do, but every single step has a specific purpose.
All right, step 1, medical examination. It says they're reviewing your medical history and oral health concerns for personalized care. To be honest, when I'm filling out that clipboard, it just feels like bureaucracy. Why is this step 1?
Because it's absolutely crucial. It sets the biological context for everything that happens next.
How so?
Remember what we just said about diabetes? If a dentist sees on your chart that you're diabetic, they know immediately you're at a much higher risk for gum disease.
Oh, right.
Diabetes reduces blood flow to the gums, so they're going to look at your mouth through that specific lens.
What about medications? Why do they need to know I take allergy meds?
Because of side effects. Hundreds of common medications for blood pressure, antidepressants, antihistamines, they cause dry mouth. And saliva isn't just water, it's your mouth's natural defense system.
I see.
It washes away acid and bacteria. If you don't have enough, your cavity risk just skyrockets. So this first step makes sure they're treating you, not just a random set of teeth.
That makes a lot of sense. So it's diagnostic, not just paperwork.
Yeah.
Okay, step 2. Examine the teeth.
The detective work.
The guide says they're checking for cavities, gum disease, and other dental issues. But, I look in the mirror, I brush my teeth. Why can't I just see if I have a cavity?
Because by the time you can see a cavity in your bathroom mirror, it's usually huge. It means the tooth structure has already collapsed. You can't see between your teeth, and you can't see the very early demineralization, which is the first sign.
So they're hunting for the invisible enemies.
Exactly. And they're also looking at the soft tissues, your tongue, your cheeks, your throat. That's where they screen for early signs of oral cancer, which again is part of that whole systemic health check.
Which brings us to the main event. Step 3, treatment, or, the cleaning. The source gets very specific here. They're removing 3 things: plaque, tartar, and stains. I feel like we use plaque and tartar interchangeably, but they're not the same thing, are they?
No, not at all. They're very different, and the distinction is why you need a professional. So, plaque. That's the soft, fuzzy film you feel on your teeth in the morning.
A tooth sweater.
Exactly. It's a biofilm of living bacteria. And the good news is it's soft. You can brush and floss it away.
Okay, so I can handle plaque myself.
You can,
Right.
if you're perfect. But nobody's perfect.
Yeah?
And if you miss a spot of plaque, say, between your teeth or along the gum line, it just sits there.
Right.
And it reacts with the minerals in your saliva, and it hardens. It calcifies. That is tartar.
And that's the bad guy.
That is the enemy. Tartar is like concrete bonded to your tooth. You cannot brush it off. You could scrub all day and it will not move.
Yeah.
That's why they call it a professional cleaning. The hygienist has to physically chip that rock off your teeth.
So the treatment is really an excavation of the stuff my toothbrush is physically incapable of removing.
Precisely. If that tartar stays, it's like a splinter in your gums. It causes inflammation, it pushes the gums away, and it creates pockets for more bacteria to hide. Removing it just resets the clock.
And the result, as the source says, is a fresher smile and fresh breath. Because, let's be real, that bacteria has to smell.
It does. Tartar is porous, it holds onto stains and bacteria. Removing it is an instant upgrade.
Okay, that's a win-win. So step 4, result and advice. The guide says this involves discussing findings and providing personalized oral care recommendations.
I feel like this is usually where I get scolded for not flossing enough.
Well, it can feel that way, but if you look at their wording, personalized recommendations, it's meant to be coaching.
Not scolding.
Exactly. This is the education phase. It shouldn't just be a silent handover of a goodie bag. If they found a lot of tartar on, say, your lower front teeth, they might teach you a different angle for your brush. It's the user manual for your specific mouth. And then step 5 is future appointments. The cycle just continues.
Right. Scheduling the next one. They mention the standard 6-month interval to maintain that lasting healthy smile.
Why 6 months? Is that just like an arbitrary number?
It's not. It's based on the rate that plaque hardens into tartar and how quickly gum inflammation can rebound. For most people, 6 months is the sweet spot to catch things before they become those big, expensive problems.
Got it. So we have the philosophy, we have the 5-step process, but I want to pivot now to the brand itself. My gentle dentist.
It's right there in the name.
They use the word gentle a lot. They promise a stress-free and comfortable experience. They talk about an expert and caring team. But how do you actually make drilling and scraping gentle? Is that just marketing fluff?
Well, according to the source, it's not just a vibe. It's a combination of the human element and some very specific hardware.
Okay, let's talk hardware. They list two things under advanced technology and pain-free experience.
Yes, digital x-rays and ultrasonic scalers.
Let's start with x-rays. They say these detect hidden dental problems. How does that make it gentler?
Well, first think of the old way, those sharp little film pieces they jam in your mouth.
Yes.
Digital sensors are often smaller and more comfortable, but the real gentle part is the diagnosis. The images are so clear, a dentist can see a cavity when it's just a microscopic speck.
So treating a tiny speck is gentler than drilling a huge hole.
Exactly. The intervention is smaller, the drill time is shorter, so the trauma is way less.
And then there's the ultrasonic scaler. The guide says this provides precise, efficient, and comfortable treatments.
This is the game changer for anyone who hates that scraping sound.
Oh, I know that sound. Metal on enamel, it makes my skin crawl just thinking about it.
Right, so that's a hand scaler. An ultrasonic scaler is completely different. It uses high-frequency vibrations to literally shatter the tartar apart. It vibrates faster than the eye can even see.
So it just shakes the tartar off.
Pretty much. And at the same time, it shoots out a stream of water to wash away the debris and keep the tooth cool. So they're not really scraping you with a hook.
They're not.
Well, they might use the hand tool for a little fine-tuning at the end, but the heavy lifting is done by the vibration and water. It's faster, and for most people, it removes that feeling of pressure and force. This is probably the cornerstone of their pain-free claim.
Okay, so it's not just a buzzword. They're actually using different physics to clean teeth. That's actually reassuring.
Correct. And they couple that with what they call the human element. The source talks about a team that takes time to understand your needs.
Away from a one-size-fits-all approach.
Which is huge. Dental anxiety is a real psychological barrier. It keeps millions of people away. Having a team that acknowledges that, instead of just telling you to tough it out, is part of the gentle branding.
Sure.
If you feel heard, you physically relax. And stress amplifies pain. Comfort reduces it.
Okay, so it's good for my health. It saves money. The tech makes it less barbaric. But there's still two huge practical barriers: time and money.
The universal hurdles. I can't afford it, and I don't have time.
And the source actually tackles them head on. Under accessibility, they talk about the budget side first.
They call themselves insurance-friendly and say they accept most major insurance plans.
Which is a big deal. But what if you don't have insurance? Or you need something that isn't fully covered?
That's where they mention flexible payment options. It's a signal that they'll work with you on a payment plan, so the fear of a big bill shouldn't be the reason you let a problem get worse.
And then the time factor. We're all busy. The guide mentions convenient scheduling.
Yeah, they talk about flexible appointment slots. It shows they respect the patient's time. They're trying to remove every piece of friction.
It really does feel like they've tried to systematically dismantle every excuse someone would have to say no.
It's a comprehensive approach.
It hurts. We have ultrasonic scalers. It's expensive. We have payment plans. I'm busy. We have flexible slots.
They aren't just selling a cleaning, they're selling a barrier-free path to getting healthy.
So let's wrap this up. We started this deep dive thinking of the dentist as this thing to endure.
Yeah.
But looking at this guide, the narrative is, it's just completely different.
It is. We've seen a visit isn't random. It's a structured 5-step loop.
Right, from medical review to scheduling the next one.
And that loop is designed to save you money, prevent pain, and, most importantly, protect your whole body by reducing the risk of things like heart disease.
And all delivered with this gentle touch using modern tech.
Oh. So what does this mean for you, the listener, next time that calendar notification pops up?
I think the big takeaway is to stop viewing oral health as a cosmetic fix. It's a long-term investment. Like the source says, it's about protecting your long-term health.
It's maintenance, like changing the oil in your car.
Exactly. Except in this case, the car is the only body you're ever going to get. And here's a final thought to leave you with. We usually think of our family doctor as the main guardian of our health. But based on what we've read today, that link between mouth bacteria and heart disease, the way the mouth can signal other issues, it makes you wonder.
It raises a really important question.
If the dentist is the one identifying these risk factors every 6 months and actually reducing the bacterial load that threatens your heart, should we stop thinking of them as just tooth doctors.
Hmm.
Maybe we should start seeing them as a primary line of defense for our total longevity.
That is a powerful way to look at it. You can't be a healthy person with an unhealthy mouth. The two are just inseparable.
A deep dive that might just save your life, or at least your smile.
Yeah.
Thanks for listening. We'll see you all